Hello, I'm Hannah. I'm going to be your nurse today. Okay, so for the sake of this video, we're going to say that my patient's name is Mary. Okay, Mary, I have an order from your doctor. It's reported that you're having a little bit of pain, that you've rated your pain as an 8 out of 10, and you do have an order for hydromorphone, which is Dilaudid. And so, first I'm going to verify that I have the right patient. My patient's name would read as follows. It would be Mary Smith, born 5/18/1963. My patient does verify that. Okay, so Mary, I'm also going to check for allergies, I don't see a allergy band, and there's nothing noted on the MAR. I would still ask my patient. She says that no, she has no allergies that she knows of. Mary, I'm going to go ahead and get my hands washed and go draw up your medication. So, checking the MAR, I have an order for 1 milligram IV push every 3 hours PRN for pain for Mary Smith, born 5/18/1963. So, looking at this particular MAR, she does have an allergy to morphine. So, she told me she didn't have an allergy, that's why it's important to look at the MAR and verify. Because she is allergic to morphine, it is okay that we're going to give this hydromorphone, because that is not, it is an opioid, but it is not the same thing. I need 1 milligram, so I've done my math. In the vial, I have, where does it say here? Oh, it says I have 2 milligrams per 1 mil. So doing the math, I know that I need 1 milligram, which is going to equal 0.5 mils. I have my, where's my gloves? There they are. Okay. I've also checked my drug book, and looking at the drug book, I know that it follows the appropriate dose, and it is appropriate for my patient for moderate to severe pain. She has rated her pain as a 8 out of 10. I've also looked at the incompatibilities. My patient does not have any primary drugs or fluids running, so I don't have to worry about that. It says to give by direct injection over no less than 2 minutes, so I will give my drug over 2 minutes at least. I have a second nurse here since this is an opioid. And with my second nurse, I'm going to waste, since this is a 2 mil vial, I'm going to waste 1.5 mils until I have 1/2 mil. You see that it says 1/2 mil? 0.5? Yes. Okay. The bubbles in there are just champagne bubbles. If there was a larger bubble, I would make sure that that was out of there. Okay, I'm going to recap. Okay, so now, gloves. I'm going to do my 5 rights 3 times. So I have a Mary Smith, born 5/18/1963, with an allergy to morphine. I have an order for 1 milligram IV push every 3 hours PRN for pain. 1 milligram of hydromorphone is equal to 0.5 mils. Again, I have Mary Smith, born 5/18/1963, with an order for hydromorphone 1 milligram IV push every 3 hours PRN. 1 milligram of hydromorphone is equal to 0.5 mils, which I have in my syringe. Finally, I have Mary Smith, 5/18/1963, with an order for hydromorphone 1 milligram IV push every 3 hours PRN. 1 milligram of hydromorphone is equal to 0.5 milliliters, which I have in my syringe. I also have my 2 normal saline flushes and my alcohol swabs to swab in between. Okay, I'm going to re-enter the room and the bedside table. And my gloves. Wash my hands and apply my gloves. I have prepared her drugs in her room, so she was always in my sight and did not exit the room. Okay. Now, Mary, this is a opioid. It is a pain analgesic. It might make you feel sleepy. You might start breathing slower, but we're going to be sure to monitor you for any adverse reactions to this. I did check your MAR. You do have an allergy to morphine, which is not the same drug. So this will not create a allergic reaction in you. Mary says she understands, she's accepting based on her pain rating. So, okay, we're going to use the Proxima. I'm going to use my alcohol swab to clean off the port for 30 seconds. Now I'm holding it this way so I do not recontaminate my central line port. Just screw this on. What was not shown was that the air was eliminated from my 10 ml syringe. Oh, and I need to unclamp this. Okay, I'm going to give a nice slow steady flush. I do not notice any infiltration. There's no bulging. My dressing is clean and clear of any redness. As I'm inserting this, I ask Mary if she has any pain or tenderness. If anything is bothering her, she says no. Okay, so before I remove my syringe, my flush, I'm going to close my clamp. Okay. I am going to swab again in between for 30 seconds. Okay. After 30 seconds, again, I am going to hold this. Going to connect, and now I'm going to unclamp, and I'm going to give this drug over 2 minutes. And then I might use this time to talk to Mary about how she's feeling. Maybe her family is coming today. If she's nervous or excited, maybe she's going home. And then just over a period of 2 minutes, watching my clock, I'm just gonna continue to just do little spurts. Now that 2 minutes has gone, I have finished. I am going to clamp, remove my medication, okay. I'm gonna clean one final time. Now this time I can be looking at Mary and just assessing, is there any respiratory distress? Do I see any kind of reaction happening? 5 minutes after I administer this drug, I want to assess respiration and heart rate. And then at the the hour mark, I should come back and reassess her pain level and make sure that it has taken effect. Okay, so I've unclamped. And this one I'm going to give at the same rate that the first half of my flush I'm going to give at the same rate that I did my medication, which was over 2 minutes. Still talking to Mary, making sure. So once I've got to the halfway mark, and that's been about 2 minutes, the last half I'm going to do in a pulsating manner. This is just going to flush that line and really give it a little, a good flush. Make sure that nothing is in there and then it remains patent. I'm going to go ahead and remove my flush. Before I removed my flush, I did clamp it again so that nothing can backflow. Okay. Mary, how are you feeling? She says she feels okay. There is no change in respiration or anything at this time. So I'm going to remove my gloves. I'm going to clean up my drugs, dispose of my vials. Oops. I'm gonna clean all this up, wash my hands, wherever my trash can is. Okay, I'm gonna dispose of all this, wash my hands, check on Mary, make sure she's okay. She has her call light, her bed is in a safe position, and then I am going to go and document what I administered, the time, the date, and how she tolerated it. And later I would document if there was an effect, if there was any change in respiration, and reassess her pain level.